Greetings, everyone. Welcome to the new season of the WCEG network on the WCEG Talk Radio. It's great to be back. I hope you are all doing well. Well, in case you're hearing about us for the first time, we are the Worldwide Community Empowerment Group where we speak live into the community. I'm Dr. Babs. I'm a physician and founder of Living at Your Finest Wellness. I'm your show host for tonight's evening segment on the holistic perspective. We're here to enrich you with information that will be not only inspirational, but impactful. So today, for debut season, we're going to be talking about National Fall Prevention. This is the month where we talk about it. We want to make sure that we are avoiding falls. So I'm going to discuss best practices to avoid falls in all ages, especially elderly. The question of the hour, I want you to ask yourself, and maybe if you have friends and neighbors nearby, ask them, what are you doing to prevent falls? All right, so my goal for this evening is to discuss why it's important, because you might be wondering, what do you mean falls? Why is that important? Well, I'll share that with you. And then we're also going to talk about ways to prevent it, right? I'm going to use an acronym that talks about just our environment, in and outside. So, and then I'm going to end with commonly asked questions. So please tag a friend, share with your neighbors, and stay updated. We're live on all social media outlets: Facebook, Twitter, Instagram, YouTube, certainly the Talk Radio Network, and we have new platforms. Did you know that we have free mobile apps now? Yes, all over Apple Store. This is all to just reach the community and make sure that everyone is empowered with right information that would allow them to live in optimal health. Now, I do want to mention two important announcements before we get started. First one is that the information shared on this talk radio is not intended as medical advice, right? It's just educational to support your holistic wellness journey. And the views and opinions expressed by the host and guest does not necessarily reflect the views and opinions of the network and management. So now that we got that out of the way, I always like to start with an inspirational quote. And this one is so cool. I saw this and I was like, wow. So it says, prepare and prevent. Don't repair and repent. So prepare yourself and prevent. Don't repair and repent. I thought that was really cool. I'm still looking for who said it. So for now, we'll say it's anonymous. All right. So let's get started. What do we want to talk about? Again, National Fall Prevention Awareness Month. We're going to look at our environment. I'm not sure if you're aware that close to half of our elderly, especially elderly, tend to fall for some reason or the other, whether it's in outside environment or in the house, for several reasons. And unfortunately, this could be very catastrophic because of injuries. The bones might be weak, it can fracture. You can cause problems with even getting back on balance. So this is so important that we talk about it, not just in our elderly, but also at all ages. So we're going to address that, but it's so very important. There is a whole department that talks about just fall prevention. So let me start off by sharing. I'd like to share let's share a picture, because picture paints 1,000 words. So I would share this image and we will take it from there. Step by step, what are the things that we need to look out for? All right, so I hope that you can see this. All right, very good. So take control. I'm gonna make it bigger. All right, so take control of your health. 6 steps to prevent a fall. So every 11 seconds, an older adult is seen in an emergency room for a fall-related injury, and falls are preventable. So the question is, if you have an older person in your home, if you're watching and you're in the older age, what are you doing to prevent this? Number one reason that we need to avoid any falls is fracture. Fracture is very common. Unfortunately, as we age, especially for women, 3 to 8% of our muscle is lost. And the muscle is what gives us the integrity of our bones and our posture. So unfortunately, if we fall, not only is the bone, if it's weakened and fractured, there can be lots of blood loss. There could be weakness in that muscle. It will take a whole lot for you to gain that strength back because there's already loss of the muscle. So there's so many things. There could be pain that will take a while to even heal. So there's so many reasons why we need to avoid falls. And again, as I mentioned, it's preventable. The first thing is find a good balance and exercise program. So why this is important is because it will strengthen the muscle. As I already alluded to, 3 to 8% of our skeletal muscle we lose for every decade, right? So we have to maintain that by doing some form of strength training. A lot of times my patients say, well, I just don't, I can't do strength training. It's not for me. Well, there are ways that you can modify it if this is something that you're not used to doing, but you do need to build the muscle. They say if you don't use it, you lose it. So we need to build those muscle, upper limb, lower limb, so that it's tight and it strengthens your bones so that you're not easily, slipping and falling. I recall a few years ago, I had, she was actually 58. So I wouldn't say elderly, but unfortunately, because, not doing much strength training, all she did was just walking. She had a loss of balance and she tripped. And it took her close to 4 months to recover because again, she hadn't developed that integrity of her muscle and her bone structure. So we want to find a good balance and an exercise program. I'm not saying that you necessarily have to go to the gym. There are things that you can do at home. So even if you need the chair for support, you want to make sure that, how balanced are you? Another reason is because all the activities that we do, whether it's when you sit down to use the toilet commode, you're actually squatting, right? So for you to build those muscles, you need to be able to stand up. If you're carrying groceries, that's muscle also, right? So you definitely want to find that exercise program which will help you build strength. The recommendation right now is 20 to 30 minutes, 2 to 3 days a week. If you can do that, even if it's just bottles, you could just get the bottles. You don't necessarily have to get the weights. If you get the weights, that's fantastic. But you want to gradually build into it. I'm not saying to go carry a 15-pound weight. No, you can start with 1, 3, and 5. I recall when my mom actually did a test, an in-body scan, and she found out that her skeletal muscle was so low, and she was like, "Oh my goodness, I'm flabby. What's going on?" And it was because of muscle, just losing muscle. And so she started trying to do some strength. And she started with a 1 pound and she actually slept so well, just doing a 1 pound. So you want to start gradually. Some people don't want to use weights. You can use your own body, right? Your own body resistance. So there are different programs that you can avail yourself of. And I'll definitely share it in the chat box so that you can avail yourself of this to help you gradually build those muscle and balance. Some people say, well, I lose balance. I can't stand on one leg. Well, it's progress, right? So you have to start somewhere. You don't want to just completely say you're not even going to make an effort. You want to try somewhere. So even if it is stretching, to stretch out those muscles, stretch out the calves, you want to be constantly stretching to help those muscles stay tight. I had somebody today, I laughed because she's young, but she couldn't touch her toes. And that's because forever she's been that way. But she has made progress because she's been able to extend past her knee. So maybe you want to get up and test and see how far can you go. Are those muscles tight? If they are tight, you need to have them strengthened and flexible enough that it can hold your posture. So that's one. Definitely good balance and a good exercise program because you want to avoid fractures, you want to avoid disability, and all those things come along with fall. If you don't have good strength and balance, most likely fall is going to be along the way. So maybe you just trip, something is on the floor and you just trip. Now, another thing that you definitely need to do is talk to your healthcare provider. Very, very important. ask for an assessment. I don't know if you've heard about the get up and go test. So if you sit right now, how long does it take you to get up? Does it take quite a bit? Do you have to struggle? Do you have to support yourself with a chair to get yourself up? That is an assessment that needs to be done by your healthcare provider, whether for you or for a loved one, because that's equivalent to whether you're at risk for fall. So what if you can't get up right away and you miss, and you fall? That is an increased risk for fall. So you want to definitely do that assessment. Most times you can do it with your primary care physician, who could refer you to a physical therapist, right? So you want to certainly do that test. So the get up and go. The longer it takes for you to get up, certainly that is an increased risk for fall. So this is all in the house, right? So whether you're in the house or you're outside, you want to make sure that you can get up and go less than 5 seconds, right? It shouldn't take you that long. Now, of course, the older we are, naturally you feel weak, but if you're strengthening those muscles, you can actually get up and go even faster than younger people. I know of a 90-year-old that does walk, daily walk, and she actually uses just small bottles and a 3 pound. And so she's strengthening her muscle, right? So you want to, first of all, do that assessment to see where you're at, what's your baseline, and grow from there. You want to build your baseline from there. All right. I want you to know that it is possible. Your muscle responds to activity. Now, just in case you are not aware, the muscle is the most metabolic organ in the body. So it does its work activity. It's more active with movement. So the more movement you make, no matter how brief it is, it will respond. Number 3, another thing that does increase the risk for fall is medication. Unfortunately, as good as medications are, they can cause you to be dizzy. I don't know if any of you have been on meds where you actually felt dizzy. It does happen. You feel dizzy. Just being on. I know sometimes when I feel nauseated and I want to take a nausea med, I'm like, I've taken care of one problem and I've created another one. So you always want to make sure that you don't have polypharmacy, especially in our older patients. If you have an older patient, older family member with you, living with you, or you live with them, or you are taking medications, please take a look at your medications. When it's prescribed to you, ask them, what are the side effects? Practically find out about dizziness. Excuse me, because if you're dizzy, you're going to lose balance, right? And that increases your risk for fall. So always review your medications with your doctor or your pharmacist. Always ask for side effects. There are medications that sometimes you can incorporate 2 in 1 so that you're not on multiple medications. So that is so important that please, always take a look at that. And if you read the side effects and it says dizziness, so ask you, this is now informed information that will allow you to equip yourself. So meaning that you don't just get out of bed, right? So you wake up and you're like, you just jump out of bed. You have to give your body time to, balance the equilibrium. So you don't want to just get out of bed. You want to stretch and then sit and then get up to get the blood circulating properly. There are ways around, if the medication causes dizziness, that you can actually get up in such a way that it will prevent the dizziness. So that is important. Always ask your primary care provider what medications I'm taking, what side effects, does any of them cause dizziness, and even blurred vision, because if your vision is affected, then you're not going to see where you're going and you're going to go off balance, and that can increase your risk for fall. The more medications you're taking, always ask your doctor, is there a way to integrate my medication? Is there a way to reduce what I'm taking? Maybe integrate them where you're not taking the same medication with just different names. That's so important that we keep an eye on that. All right, so let's go to the 4th thing. Vision, so important. I had a patient today that could only see out of his right eye, his left eye. He was given a prescription which he didn't feel, and it's been almost 4 years now, and affects his vision. And this person uses hammer. He uses all these missionaries. So he definitely needs to get that checked. And he said something today that it really resonated with me. He said they told him when he was getting his prescription, when he had his eye test, he said, you can get another job here and there, you can change job, but you can't get a new eye, right? So you got to protect your eyesight. So it's so important that with vision, it's recommended if you're on blood pressure medicine, diabetes medicine, any of those things that cause any, changes in your blood vessel, you want to have that checked at least once to 2 years. With diabetes, they say once a year. With hypertension, depending on how controlled it is. So that's why I'm giving you a range, 1 to 2 years. But try your best not to wait so long out of that period. Even if you're wearing glasses, they need to always check your eyes to see where it's at. So you want to do that annually, preferably. All right. And you always want to update your eyeglasses. You don't want to be using glasses that the prescription has been, you've had it for 5 years. So you definitely want to pay attention to your vision. Another reason why your vision matters is because if you are off balance and your vision, that is just like a double whammy. It's just a catastrophe that is waiting to happen, because if you lose your balance because you can't see, then you're risk for falls. So that is very important. Please, if you haven't seen the eye doctor in close to a year, go ahead and schedule that appointment, because you want to make sure that you don't increase your risk for fall. All right, now let's talk about home. Home, which is the H, right? We have to make sure that our homes are safe. If things are on the floor, please pick them up. Don't wait for danger to occur. Remember what I said with my inspirational code, you want to prevent, right? Instead of waiting to repair. A repair for a fracture takes many, many months. It takes a long time because the femur bone, it has one of the highest supply of blood. So if anything happens there, it takes quite a bit of time to heal. So you want to make sure that the home is safe. So you want to make sure that you don't have wires extending from one end of the home to the other, one end of the room to the other. You want to make sure that your furniture is spaced properly, especially for our older ones. And you want to make sure you have proper lighting, right? So proper lighting in the evenings. I know that we encourage, at least I encourage, that we should dim the light, but you want to make sure that it's still a safe environment so that you decrease the risk of falls. Other things that you want to pay attention to is hazard. So, if sometimes, especially if it's a school in my home, my kids, I don't know why they do that, but they come home from school, and I don't know if they're just too excited to get home, and they leave their bag right in the front of the doorway. I don't know if I'm the only home where that happens. And then their shoes and trips can happen. Thank goodness, because I know that that's what they do. I am always like, moving it out of sight, just moving it away so that nobody trips. So very important, please, anything that would cause people to furniture, bags, shoes, electrical wires, all keep the home safe, make sure the lighting is safe as well. Those are very, very important things. Stairs, oh, very important. Bathrooms, very important. So you have to know what you're able, as you're building your muscle strength, or as you are, increasing your strength training. Are you able to climb stairs? Do you need to support? Do you need to hold the rails? Please do so. There's no shame in that. It's better to do that than tumbling down the stairs, right? Or missing a step. So please, 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 always make sure there are rails in the bathroom too. Like if you have to get into the bathroom, the bath, do you need additional support? So there are different companies that would help with older patients to give them support for them to be able to lift themselves, then to slide. You want to make sure that the floors in the bathroom are not slippery. Just the same way that if we go to a store, we want to make sure if there's water, they would put a sign that this is slippery. So you want to pay attention to all those things in the home. Nothing is too much, nothing is too small. You want to avoid the risk of falls. Now, 6 is talk to your family. And I think I've been saying this all along about how you should talk to your family members, what kind of conversation, maybe have a sit down together and survey your home. What are things that are in place or out of place? how can we make this a safer environment, not just for yourself, but of course more so for the older family members in the home. You could also have an evaluation done in the home. I don't know if you're aware that an in-home evaluation is available, especially to our older patients, so 65 and above, so they can do an assessment, home visits. All of that gives an idea of what your home environment is and an ability to make recommendations. So that is certainly things that you want to pay close attention to. It has to be a family conversation. If there are little kids in the home, why are we doing this? Because we do not want to fall. It takes longer time to heal. So this website actually is one, if you see it, that there's more information, and it's actually, there's an assessment that you can take that would enable you to, there's an assessment that you can take that would enable you to clarify how safe your home is, right? So I would say visit this website and just do assessment of what's going on in your home. And there's also opportunities for them to send you resources to, improve your home environment. Now, what's about your vehicle? Let me talk about vehicle. Very important. I've talked about outside environment, right? And your home. But what's about the vehicle? If you're driving, please make sure that you are definitely wearing your seatbelts. I mean, I know we say this all the time. It goes without saying. Make sure you're wearing your seatbelts. Make sure that the mats, right, they're not slippery. So when you're getting out of the vehicle, you don't slip, you don't fall. You have the arm raised and the support that is needed. You want to make sure that the car is in good shape, so that you don't increase the risk of falling or even getting into an accident. So that is for your vehicle. All right. So those are very important things that I would like to share with you. Now, I will shift gears now. I'm going to stop screen share, and I'm going to share about commonly asked questions, right? Because that is where we are at the moment. I hope that so far that I've been able to emphasize the importance for avoiding falls in all of us, and more so our older patients, right? Because every time when I used to work in the urgent care, we will see, or even just, in the regular clinic, I would get a call that somebody fell and this is what happened to them. It could be very dangerous and risky. So we definitely need to do this assessment for ourselves. Now, in terms of commonly asked questions, I've had one in terms of strength training. Are you telling me that my 88-year-old mother needs to do strength training? She has arthritis. How is she going to do that? Well, the good news is anything is better than nothing. The muscle needs to be activated. So you don't have to be, like going all down and doing squats and doing bench presses. You can use the bands, right? So there are bands, and I have some with me somewhere here to show. You can just do the bands. So even if you just take the bands, and all that you're doing is that you just stretch. Guess what happens? You're activating the muscle. So your 88-year-old mom can still do something, but start slowly, right? So it might just be that the band is this way, and as she extends, and then maybe she gets stronger. And I promise you, when my mom started doing this, she actually slept a whole lot better. She felt well. All the pains in her knees had improved significantly. So you want to start somewhere with bands. The bands are really good. You could just, instead of putting weight against your knee, you can just sit on the carpet and then extend them. I will definitely share some resources, come back again and share some link that you can refer to as an example of things that you can do, especially if you have problems in the knee. You can also use a chair for support, right? So hold on to the chair, you extend both legs, one at a time, you extend out. That's a way to improve your balance. Of course, hold on to a chair, hold on to the wall. So something is better than nothing. You definitely want to ensure that you are strength training. Your 88-year-old can do it. Maybe do it together as a family, make it fun. I do encourage stretching before and after. So important that even if you're walking, when you come back, just stretch. The reason why you stretch before is because you want to, wake up the muscle, right? It's been quiet, dormant. You want to prepare it for the oxygen flow, and you want to prevent injury. You want to stay hydrated though, okay? So make sure you're drinking water. And then after you've done the activity, whether it's a cardio, whatever you've done, you want to stretch again. But this time around, you're doing more static movement, which will be to maintain that stretch so that you can let the muscle heal properly because it's gone through some strenuous activity. So that's very important. Another question that I get asked quite a bit for older patients, more so for the risk of fall. I already alluded to it in terms of the vision, but this one has to do with the medications. What time of the day is better for me to take my medication if it gives me dizziness, if it makes me feel a little woozy and weak? Well, definitely depending on how your day is, but also talk to your doctor because you might have a more specific need that I'm not privy to. But generally, we say, depending on how active your day is, if it is not something that affects you right off the back, then you can take it in the morning, and then hopefully, by the time you're out and about, you're not getting all that effect from it. But if it's something that affects your day is fully busy and it affects you all through, then you can take it at night, provided it's not a water pill. Of course, I don't want you getting up constantly at night to go to the bathroom. And speaking of getting up at night for your older patients, you might need to make sure that, again, going to the bathroom, there's light that comes on their way. You don't want to be guessing where the bathroom is, like I guess when I'm going, because I kind of have an idea where the bathroom is, but you don't want to do that. Make sure that even if you don't want to try and turn on the light, you have something like a motion light that when they're going into the bathroom, the light comes on because they need to be able to see where they're going. All right. And you want to make sure that liquids that they're not drinking at least 3 hours. I'll say maybe 2 to 3 hours before bedtime because you don't want them getting up to use the bathroom. If they say they're thirsty, maybe just put ice cube in their mouth so that they don't feel dry. So those are some of the things that I know that has helped and the research has shown has helped to minimize the fall risk. So I hope that this has been helpful. If there are any questions, please bring them my way so that I can, respond to them. But generally speaking, these are the things that we found that have helped to just decrease the risk of falls, especially in our older patients. Again, the month of September is National Fall Prevention Awareness Month. So now that you want to help not just yourself, but your family members. The question is, are you doing your best to avoid falls? So I hope that it's been valuable. And now that you've had the information, how are you going to implement it is the question. I want to share that in my practice, I care for the whole family. I'm very passionate about the whole family. I want them to live at their finest well-being. And I use a holistic approach with a healthy lifestyle so that we can stay whole, vibrant, no matter the age, and we can stay healthy. So, because we're all steadily worth it. So I want to thank you for staying tuned and listening. Please share this, the WCEG network with your friends and neighbors. This is all about us getting healthier together, right? So share this particular episode of Holistic Perspective with them, let them learn about some of the things that they can do to prevent falls, because it's not a good place when you fall down and you hurt yourself. I had a cousin once who slipped, and she was in her 40s. It took her and she fractured her ankle, and it took her a while to heal, and still not even walking properly. So we do want to, of course, even though we're preventing falls, we want to make sure that we're eating nourishing foods to strengthen our bones, because that also matters, right? So we're having the nourishing foods, the fiber, the calcium, the vitamin D, going outside for your sunlight, all of that matters to prevent falls. So I want to leave you with this nugget. I like to leave a patent nugget with you. An ounce of prevention is worth a pound of cure, right? So I know that I don't want to fall. I don't want to fall and hurt myself, and it will take a long time to heal, and I'll need crutches and all of that. So I'm making sure that I'm eating nourishing foods to give me strong bones. I'm making sure that I do my strength training to give me strong muscle, right? I'm doing my exercise. I'm staying hydrated. I'm doing all the things, and so I know that you would do the same as well. So I look forward to seeing you back for our next season, our next episode rather, and that will be next month. And we'll post the date as we get closer and closer. But until then, I want you to take good care of yourself. And remember, let's prevent falls. Take care. God bless.